This is Startup Health TV, where we celebrate the entrepreneurs and innovators who are transforming health. I'm Logan Plaster. My guest today is Justin Ayars from equalityMD. Justin, great to have you in the studio.
Great to be here. Thanks for having me.
All right, let's just level set. Tell us what equalityMD is.
equalityMD is an LGBTQ virtual first telehealth platform, and we're also a data analytics company.
Okay, how'd you get into this work?
Accidentally. I was a healthcare trial lawyer years ago before the Great Recession said,
Okay.
go do something else.
Okay.
And I defended insurance companies, so I worked on the dark side.
Interesting.
And I saw how messed up our healthcare system was, and I knew there was a better solution.
Messed up
And
how?
Patients weren't being treated as human beings.
Okay.
And I was a part of the problem defending insurance companies. And I wasn't so upset when the pink slip finally came. I became an entrepreneur thereafter. 13 years later, the pandemic hit, and the company I had no legs because we launched our product in March of 2020.
Gotcha.
And when the world stopped, we stopped. And I looked back at my life and realized I'd created a massive network by helping companies learn how to authentically communicate with $1.4 trillion LGBTQ consumer market.
Okay.
But what I really wanted them to understand was you have to instill DEI into your corporate DNA to be authentically inclusive, to attract and retain the most diverse talent and be competitive and culturally relevant. And they didn't want to hear anything to do with that. They just wanted to market.
Okay.
And so when COVID hit, I thought, what's the one question as a lawyer that I've been asked more than any other? And that's, where can I find a doctor that makes me feel safe? And I thought, I've had that question my entire life. I faced discrimination when seeking care. 56% of our community has, causing 28% to avoid care altogether or even avoid critical medical procedures. And that's a big problem for individuals, communities, and families.
What was your approach to trying to address the challenge?
We started with a direct-to-consumer solution where we built basically like a Match.com for inclusive telehealth.
Okay.
And we had providers go through cultural competency training, and then we paired them with patients via machine learning algorithms. So the patient was always the superhero of their own healthcare story, and they got to pick the provider they wanted based on our algorithm and stick with that provider for continuity of care or pick some other provider. And it worked for the patients. They loved it. They could be their authentic selves because the providers had already received the training to be there to make the space safe for them. The providers loved it because we unmasked an invisible patient population of over 30 to 40 million people. And it's very challenging for providers to reach that demographic after they find them, if they can, with a message that resonates.
Okay.
And so we served as a marketing engine for them, bringing them to their digital front door.
Gotcha.
But it didn't work for equalityMD because we couldn't scale.
Okay.
So we pivoted to a B2B model, and we're relaunching that in 2 months.
Okay, and what will that look like?
Much the same in terms of the provider training, only we're working with a new partner that goes deeper into different types of training based on different verticals.
Okay.
All the providers will also receive continuing medical education credits, which is very important. We have some very exciting prospects on the horizon with partnerships with 2 major national payers and 1 major national health system. And so as we go to market with a temporary white label solution, we're in parallel building our own solution of an entire network of payers and providers and selling that to businesses through our main channel, which is the National LGBT Chamber of Commerce.
Got it. Talk to me a little bit about the training itself, because you said that what's important to you is that it's not just marketing about DEI, but that it's in the DNA of the company.
Absolutely.
And so thinking about training a physician, it's like getting to the DNA of the person. Talk to me about what some of those training modules look like.
It's when I used to do training for marketing, it wasn't just training the C-suite executives of a hotel, for example, of how to make their venue more inclusive. It was all the way down to the bellboy and the person at the front desk, because that's the first touch point. And our community has received discrimination from the waiting room to the emergency room in every step of the process in between. And that's unacceptable. So the training isn't just for the doctors or the nurses, the providers, it's for the support staff as well. So that if a customer actually picks up the phone to call in with a problem, the technological solution person has been trained themselves. So they use proper pronouns, they ask the right questions, they understand some of the background of what the community itself has undergone in terms of discrimination and underserved patient population, even if they don't self-identify with the community.
Got it. Moving forward, who's an ideal partner for equalityMD?
Well, right now, some of the health systems and payers we're talking to, but we have a very enviable network. And I jokingly say I've been building equalityMD my entire life just by being my authentic self, showing up and giving first. And so I'm now tapping into that in a way that I never thought I would. I swear I would never go back to healthcare after working for the dark side. But now I'm doing so in a more meaningful, authentic way. So we're able to capitalize on our pre-existing partnerships, which are valued at over $27 billion. And for example, with the National LGBT Chamber of Commerce, they have 53 chapters across the country. We're going to join every chapter, and that will enable us to scale organically and build trust and become a trusted community anchor in each new market as we grow.
Question for you as a CEO, you're building a company that's about helping other individuals be more inclusive, be more competent about not othering the person they're taking care of, and that puts a spotlight on you to build your company in that fashion. I'm just kind of curious, what are some of the things you employ strategically to make sure that that's the culture of your business?
Great question. Culture is the most important thing for me in our company. There has been so much discrimination in the medical community itself. There has been so much discrimination in the venture capital community. 2 quick points on that as I go with a lawyer roundabout way of answering your question. I have been told by some people, why do your people need special treatment? And in the VC world, why don't you go to your people for money? When I'm thinking, we're all human beings, that we cannot segment like that. We cannot have that discriminatory language. So the culture that I'm seeking to instill and have been is one where we bring into our leadership team and even our DevOps team the most inclusive people possible. And that runs the gamut. But particularly for LGBTQ+, and we're a community that's been discriminated against in so many ways, on so many levels, so many verticals. So if I can hire tech talent from groups like Out in Tech, or work with our partner Gaingels, which we're a portfolio company of, to find more talent through them, through marketing, for example, then I'll be able to utilize those partners and utilize that talent to make sure that we are the company that we say we are.
Awesome. What are you most excited about for 2023?
I'm excited to deploy a B2B market solution that solves real-world problems, help companies achieve that elusive double bottom line. And we were just written up in a publication 2 days ago, our presence at Vive, as being life-saving medical matchmaker. And I want that to be sort of a slogan for us. We're a life-saving medical matchmaker, and I love that.
Love it, Justin. Thanks for taking the time with me today, and we'll be watching your progress this year.
Thank you, Logan. It's been fun.
All right, thanks, Justin.